All right, go.
Hi, I'm PA student Chaim Sigler, and I'm going to be doing a physical exam on you today. Okay? Go ahead and wash my hands. I'm just going to go. How are you feeling today so far?
Pretty well.
Good?
Yes.
And then any pain today?
No.
Okay, normally what I would do is I'm going to start with taking your weight, your height, and your blood pressure, and then we would go ahead and continue with the rest of the exam. Okay?
Okay.
What I'm going to do first is I'm going to inspect the head for any signs of lesions, masses, or any abnormalities. I'm looking for any signs of infestations. I'm looking for signs of male pattern baldness and things like that. Okay, I'm going to go ahead and inspect. No signs of infestations. Any tenderness?
No.
Okay, great. What I'm going to do is I'm going to palpate the frontal and the maxillary sinuses for any tenderness. Let me know if you feel anything, any pain.
No. No pain.
Great. I'm going to palpate the TMJ for any tenderness. Anything? Can you go ahead and open up your mouth for me? Okay, no signs of crepitus. Now, can you go ahead and can you bite down for me? Okay, and one more. Okay, muscles of mastication, cranial nerve 5 are intact. We have the mastoid and the temporalis. I'm going to go ahead and look behind at the mastoid for any discolorations. Okay, any tenderness over here?
No.
Great. Okay. I'm just looking again at the contour, making sure everything is symmetrical, and looking at the eyes, the nose, the lips. They look pink and smooth. The eyes, no signs of any icterus or injection, no signs of edema. Okay. Looking at the conjunctiva and the sclera. Great. Any tenderness or anything?
No.
Great. What I'm going to do next is I'm going to palpate for the lymph nodes and let me know if you feel any tenderness. Okay? Occipital, preauricular, postauricular, anterior cervical, tonsillar, mandibular, submental. And go ahead and shrug your shoulders for me. And supraclavicular. Great. Now go ahead and shrug your shoulders for me one more time. Cranial nerve tested. Great. What we're going to do next is we're going to look into your ears and into your nose. But before I do anything, go ahead and cup one ear for me. And tell me if you can hear this on this side.
99.
And go ahead and cup the other side for me.
99.
Great. Okay. What I'm going to do is I'm going to look into your ear. Let me know if you feel any pain or anything. Okay?
Okay.
Sorry about that. Okay. The airway canal seems to be unobstructed, no signs of cerumen. The landmarks are visible. The tympanic membrane seems to be white and pearly gray. Can you go ahead and plug your nose for me and blow out? And tympanic membrane is mobile with no signs of fluid in the middle ear. Great. And normally I would do this bilaterally, but in the interest of time, we will continue this way. What I'm going to do next is, I'm going to place this on top of your head. Can you go ahead and let me know when you hear it equally on both sides or feel it?
I do.
Okay, great. Okay. Weber is midline, and what I'm going to do next is I'm going to place it behind your ear and let me know if you can hear it and when you can't hear it anymore.
I can hear it. No. Yes.
Okay. Same thing on the other side.
I can hear it. No. Yes.
Okay. AC is greater than BC bilaterally. Great. What we're going to do next is we're going to look into your nose. Just relax for me. Okay. Mucosa is pink with no signs of any lesions. Mucosa is pink with no signs of any lesions bilaterally. Go ahead and tilt your head back for me a little bit. And And again, mucosa is pink, no signs of any lesions. Great. We're going to do this. Can I have you stand up for me, please? We're going to do the visual exam now. What I need you to do is, can you go ahead and hold that about arm's length, cup one eye for me, and read the smallest line that you can read.
63925.
Okay, and do the other eye, please.
63925.
Great. Do you wear any contacts or glasses?
No.
Okay, you are 20/20 vision without any correction.
Great.
Now, just look straight at me and let me know when you can see my fingers in your visual field. Okay?
Yes. 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 Yes.
Correct. Okay, patient's visual field is equal to examiner's. Next, what I'm going to have you do is, can you go ahead and just follow my finger for me without moving your head? Great. Okay, one more thing. What I'm going to do is, can you go ahead and look at a point at the wall for me? And now go ahead and look at my fingers. Great. Okay, now we're going to test convergence. Okay, just go ahead and look straight for me. Okay. Great. And one more thing, just look straight for me. No crescent shadow noted over here. No crescent shadow. Okay, normally I would turn off the lights for the next part of the exam. The pupils seem to be equal, round, and reactive to light and accommodation. And now go ahead and sit down for me. Okay, normally I would turn off the lights for this. What I'm going to do is I'm going to be looking into your eye. Okay, just relax for me. And let me know if there's any discomfort. Red light reflex noted. And the anterior chamber and vitreous are clear. No signs of AV nicking, a cup to disc ratio of 2 to 3. No signs of any hemorrhages or exudates. Now go ahead and look in the light. Okay, macula was not noted, and I will do this bilaterally as well. What I'm going to do next is I'm going to do the bimanual exam for your mouth. Lips seem to be midline and don't seem to have any lesions and whatnot. Can you go ahead and open up your mouth for me? Okay, go ahead and stick out your tongue for me and wiggle it right and left for me. Okay, now can you puff out your cheeks for me and give me a big smile? Great. Now frown for me. Great. Okay, can you go ahead and open up your mouth? And I'm looking, no signs of any lesions, tongue seems to be midline. Can you go ahead and stick out your tongue and say ah? Ah. Okay, uvula is midline and elevates upon phonation. And gag reflex. Okay, great. We'll test the teeth, go ahead and get out here. Open up. Any tenderness? Okay, teeth seem to be in good repair, no tenderness. I'm going to start with the bimanual exam. I'm feeling for any masses or any stones in Stenson's duct or Wharton's. Any tenderness or anything?
Ah.
Okay, great. Excellent. And patient's breath is inoffensive. And what we're going to do next is, can I just have you swing to the side a little bit? And I'm checking for the thyroid, make sure there's no enlargements or anything. Can you go ahead and look to the right for me? To the right. Thank you. And look down. Okay, and turn to the left. And look down for me a little bit. Okay, no signs of thyroid enlargement. And that concludes our
He can cure my every pain. He can make me well again. Dr. Love, he ain't got no competition. Only he writes my prescription.